So without further ado, I'm going to reintroduce Ian Souls, who has 19 years of clinical experience treating lymphedema as a Balder certified lymphatic therapist, and he's a registered massage therapist. Ian's specialty is in manual lymph drainage and combined decongestive therapy. So I think I'm just going to leave it at that this time. He's co-founder of Salutaris Centre for the Lymphatic and Massage Therapy in Edmonton, Alberta, with Diane Pitts. So we'll go ahead and let Ian proceed with the evening. Before we begin, there is coffee and cookies for those of you that have been sitting in here for a while. It's outside. Feel free to help yourself. And later on, there is an evaluation that we will ask you to complete for tonight's session. So,
thank you. Does this mic work? Everybody can hear me? Good. Let's move this out of the way and give me an opportunity to wander around a little bit. If you need to get up and have a coffee or cookie or something because I'm boring you, go right ahead. What I'd like to start with first is a recognition that this is National Nursing Week, and we appreciate you being out there and all the hard work you do. So we've got a number of nurses, I believe, in the room tonight, and I just thought I'd take the opportunity to recognize you. Early detection. How do I know I have lymphedema? Lymphedema is diagnostically or clinically diagnosed. There's no special tests for it. It is usually diagnosed on the basis of how it presents in the case history of the patient. So it's a matter of looking at a number of factors. Now there's things like positive stemmer signs that you can pinch between the toes just above on the dorsum of the dorsum of the foot, and help you to determine whether there's lymphedema or not. But for the most part, it's a matter of actually noticing it as a result of the progression of edema. You'll notice it well before anybody will diagnose it, for the most part, and you'll notice it as feelings of heaviness or achiness in an at-risk limb, or you may also get it on a sidewall or chest. We've seen breast edemas, head and neck edemas, genital edemas. And if you begin to experience those kinds of things, a sense of heaviness, a sense that there's just something not right, you need to see your doctor, and we advocate seeking out combined decongestive therapy. Let's talk a little bit about the signs and symptoms of lymphedema. Initially, lymphedema is defined in 4 stages. It used to be 3 until quite recently, and now they've added a stage 0, which is really subclinical. And then there's stage 1, 2, and 3. Initially in stage 0, 1, your symptoms will come and go. So you'll have some swelling, you'll have some sense of heaviness, you may have some loss of sensation, you may have some achiness, and it'll resolve. And then it may come back again, and then it may resolve. And sooner or later, it stops resolving. You'll get sensations of fullness, tightness. If it starts getting worse in stage 3 kind of lymphedemas, you can get bursting, pain, tingling, aching in the area. You'll get lymph fluid sometimes weeping through the tissue, through your skin. So it'll get wet. It's called lymphorrhea, and it's one of the later stage 2, stage 3 signs. There'll be visible puffiness and swelling anywhere in the area that's disrupted. So, for instance, if you're radiated in the axillary area, you may get some swelling or some of these sensations on your chest wall on the side. You may get it in the breast area. You may find it in your arm. If you've got a problem with respect to the lymphatic system in the pelvic area or in the inguinals, it'll generally present in the legs first. It can also present in the genitals, pelvis, abdomen. One of the things to watch for are red patches or rashes that persist or may worsen because they do indicate infection. And people with lymphedema are at risk for infections and for cellulitis, and we'll talk a little bit more about that as we go along. In stage 2 and 3 lymphedemas, you know, if you haven't been treating them, you'll get situations where what we call it pitting, or there's hard areas of the affected limb or area. What we mean by pitting is if you take your finger in the swollen area and you push it into it, that indentation will actually stay there for a while. So you can actually see the indentation of the pressure. What that's caused from is there's a lot of proteins in the area. It's getting more fibrotic, and those proteins are beginning to organize. And so the tissue is denser, and so you'll get some pitting and hardening happening. And you'll see skin changes, and Dr. Rao, the dermatologist we've got coming in next week, he's going to talk a lot more about the dermatological conditions associated with lymphedema. He's going to talk about cellulitis, lymphorrhea, those kinds of things. So I'm not going to spend a lot of time on that tonight. Upper extremity lymphedemas, swelling chest, breast, arm. You may get pain. Lymphedema doesn't generally have a lot of pain associated with it for most people, but it does present sometimes with pain or certainly discomfort. So there's a pretty big range there in terms of people's experiences, but for the most part, people don't find a lot of pain associated with it. Cording is an interesting one. I don't know how many people are familiar with it. It generally presents with arm edemas, although I've seen them as well on chest walls and breasts. Cording's an interesting thing. There's been a fair amount of research done about it, but nobody's quite certain yet even what it is. They're thinking that it could be some hardening of the lymph fluid within the vessels themselves. It could be fibrotic changes along the major collectors. There can be pain associated with cording, restricted range of movement. And it's something that sometimes resolves on its own. Manual lymph drainage is very effective for resolving cording, and some of the physio techniques are appropriate for it as well. You'll also find in the upper extremities restricted ranges of motion with lymphedema and some sensation deficits, although oftentimes those can be associated with the surgery or the radiation that's been done as well, so they're not necessarily due to the swelling, although at times they are. Weakness, heaviness, tightness, fullness, stiffness, all of those kinds of things. Body image problems. People begin to have concerns about how they look, and it's noticeable to others, and especially as it gets more progressed, people get a lot of concerns around body image. And then there's daily living problems associated with it, and Pauline's going to be much more apt to speak to those last two areas than I am. But many people, especially if you get into leg edemas, for instance, footwear becomes an issue. It becomes an issue particularly in Alberta. What are you going to wear in the winter? How are you going to get your boots on? It's a problem for some people when it really gets progressed in terms of, I've seen people not be able to get into full-length sleeves where they're wearing sleeveless shirts all the time because their arm's too big, or they can't wear a normal sized pair of pants. So you get a lot of those kinds of problems associated with dressing. You get problems associated with the kinds of things you can and can't do in terms of your daily lifestyle. If it's a lower extremity edema, we'll see swelling in the buttocks, in the abdomen, in the genitals, in the legs. Again, pain, restricted range of motion, sensation deficits, just the same as the arm, heaviness, weakness, tightness, fullness, body image problems, daily living problems. So many of these things correlate between the two. With midline edemas as well, we often end up talking a lot about limb edemas, but in midline edemas, by which we mean somewhere on the torso, the abdomen, the pelvis, head and neck, a lot of those problems exist as well, especially when we're getting into, I've seen tongue edemas after surgeries, facial edemas, all of those kinds of things are very noticeable and people are very conscious of them. How can lymphedema be prevented? Currently, there's not a lot of research about prevention out there. It's not really well understood in terms of, as I said last week, the pathophysiology of lymphedema and how it develops. So we don't know a lot about how we can prevent it. There are a number of things, particularly in the last 20 years, I've seen a big change. Surgical approaches have altered so that many people now, they used to be doing mastectomies with a vertical scar. They're not doing them anymore. They're doing them with lateral incisions because it disrupts the lymphatic system less. They're getting much better in terms of radiation therapy with respect to being more targeted, having more control in terms of the amount of radiation area that they have to actually affect. Some of the radiation therapies that we used to see were very deep and lungs would get affected as well, and you'd get a lot of thorax edemas as well as chest wall. And then early detection technology are beginning to provide reduced instances of lymphedema, and that's an area I really want to emphasize tonight in terms of what I think about the importance of early detection. In the future, there's going to be more conservative, smarter techniques, treatment to reduce the incidence of lymphedema. We've got things like lymph scintigraphy, which are nuclear medicine approaches where you can map the lymphatic system. But in fact, nobody's doing it right now. And they're going in doing surgeries without knowing whether the particular patient on the table is at risk for lymphedema as a result of their anatomy or as the function of their lymphatic system. But as we begin to go further into this, these technologies can begin to inform the kind of practices and the kind of surgeries. In fact, I'm dealing with a patient right now with an orthopedic surgeon where I believe she has a lipedema, which is a mixture. It's a mixed edema. It has to do with pathological changes in fat as well as fluid. And she's had 2 arthroscopies on her knees, 1 hip replacement, and she's now going in for her 2nd hip replacement. And one of the things we're talking about is the possibility of doing a lymph scintigraphy because it may inform the surgery with respect to whether it's going to exacerbate the condition she already has or whether there's something that could be done. If we're able to pull that one off, that'll be a first because we don't have a lot of surgeons doing that yet. The other thing in terms of lymphedema is even if you're at risk for lymphedema and you don't have any presentation of edema at this point in time, try and prevent infections. Cellulitis, infections of endematous areas or areas at risk for edema damage the lymphatic system and can radically change the actual experience that you have with your lymphatic system. Avoid obesity. Attain and remain at normal weight. We're seeing a whole pile of this in North America now, especially in the US. They're seeing even more than we are, but we're not far behind, where there's a lot of problems being created because people are overweight. And I'll talk a little bit more about that as we go into this further. Exercise to be fit, maintain good muscle tone. All of those kinds of things can help to prevent the onset of lymphedema. Early detection and intervention, I believe, holds the greatest promise for reducing the incidence of lymphedema. And as a result of that, I'm a real strong advocate of taking pre- and post-operative measurements before surgery. We don't generally do that now. They're beginning to do that more with respect to cancer-related surgical or radiation initiatives. But orthopedically or in any other kinds of surgeries, we're not doing any of that at all. And it's easy enough because, is that me? Nope. Somebody. One of the things that that's really important about this, and it's caused me to scratch my head for years, is how can we assess that we've got a lymphedema if we don't know what the size of the limb was before we started? And wouldn't it be a whole lot easier just to do a quick calculation of the volume of the limb before we do it, so we have a baseline upon which to compare to, so that we can then clinically assess whether we actually have a problem much earlier than somebody running into it. And I'm going to talk a little bit later even in terms of some of the new technologies that are on the forefront that allow us to do that even more so. So I think that that's something that you're going to see happen more and more, is that pre- and post-operative measurements before surgeries are going to become the norm. But I'm pretty optimistic in the medical community of how quickly things change, I understand. It's also important for you as a patient to monitor your limb volume and any endogenous midline regions. So pay attention to it. And the earlier you can become aware of it and don't feel like you're, crying wolf, because you give people the opportunity to intervene much earlier and provide you with a more positive outcome. I think it's really silly that we get down the road or we define and say lymphedema is a 20% difference between the affected and unaffected sides. Well, the horse is out of the barn. A whole bunch of them are at that point, and now we're trying to round them up and get them back in. If we can intervene earlier, if patients are more cognizant of limb volume changes and clinicians are more cognizant of that, we can intervene and have a more positive outcome. There's a whole bunch of tracking devices that are coming out now. Smartphones and mobile device apps are becoming readily available to assist with monitoring lymphedema. Here's 3 of them that I like, and I give them in the order I like the best, actually, although I should do what Michael did last week and say I don't have any interest in any of these, so not going to make any money selling you one of those. I don't know if they are either, because they're cheap like borscht. Lymph Tracker for iPhones and iPads provides you information. It's just an app. I just bought it the other day for $1.09. I got it on my phone here, and it provides information about lymphedema. It provides measurement options for your hands, your arms, your feet, your legs. It measures every 5 centimeters up the limb from the wrist or the ankle up. I really like that. In our clinic, we measure every 4 centimeters, but 5 is certainly more than adequate. And it gives you a much better limb volume to know more about it than doing it as some of the others do in 3 measurements. It reports the percentage increase over the last measurement, which is really nice. So you go in, last month you measure your leg and you put your calculations in. Next month you measure your legs, you put your calculations in, and it tells you what your percentage increase was over last month, last time you measured. So you can actually track it yourself and pay attention to it. It provides information on treatment options. They're pretty reasonable. And it also creates reports for healthcare professionals about your history of your lymphedema while you've been tracking it. So it's a great little app, especially for $1.09. There's another one for Androids called Lymphedema Calculator. In this case, there's only 3 points of measurement, and it only relates to the affected and unaffected arm. So the last two of these are specifically created as a result of breast cancer initiatives. 3 points of measurement, I think, is probably the lowest standard of determining lymphedema that you can have out there. And basically they're doing it at the wrist, at a midpoint, and the upper arm, and comparing it to the other side. Edema doesn't present always in a uniform fashion, so you can get heavier in your forearm, and if that's not included in where the actual measurement is on the limb, then you could in fact have a lymphedema developing, and you would know it. Whereas if you're measuring every 5 centimeters, you're going to actually hit it. The other one is a lymphedema breast cancer app that was developed for the iPhone. There's 6 points of measurements on it. It compares the affected and unaffected arm, which is good as well, and provides information, risk reduction, early detection, signs and stuff. But it doesn't address leg edemas, so it's only useful for breast cancer. Interesting comment by this cancer in 2009. They said, today most lymphedema is diagnosed by it being visually apparent. But by that point, you've already got fibrotic changes taking place in the limb or in the edematous area. And you've got you've got fat being deposited, right? And you've got a protein-rich fluid that's stuck there. So, you know, the horse is well out of the barn at this point. And, you know, most of the medical models that are emerging are saying early assessment, early diagnosis, early intervention prevents progression. And for the most part, baseline measurements of girth and volume assists in determining the size and whether the intervention's early enough or not. Until recently, techniques involved measuring limb with a tape measure, immersing limbs in water to displace the water to see what the volume is of the limb, or passing over a limb with a laser. They just got a machine probably a year ago at the Cross that measures arms and legs by passing a laser over them. And they've been favored mostly for diagnosis of lymphedema in the past. Currently, there's no accepted standard for the definition of lymphedema with regard to volume and girth. And that's why last week when I presented the prevalence information, you saw things like breast cancer-related lymphedema occurs in between 5 and 70% of breast cancer patients. You know, well, that's a pretty big range. Why is that? Well, it's because there's no accepted definition of what lymphedema is. So some studies use, you know, different ones than others. The different criteria that have been used to date is a 2 centimeter circumferential difference in measurement of the affected and unaffected sides, a 200 milliliter volume difference of the limbs between one side and the other. Now, that's a big difference in terms of whether you're talking about an arm or a leg at 200 milliliters. And others are a 10% change in limb volume between the affected and unaffected sides. Again, if you look at this with respect to chest edemas, breast edemas, genital edemas, head and neck edemas, there is no definition at all. There is no way of assessing that at this point with these tools. Because there's a lack of standard definition, there's a wide variance in the reports of the incidence of lymphedema. Here's the future. It's called bioimpedance. It was developed in Australia. It is available in the US. It is in front of Canada Health folks trying to get approval up here right now. You can only use it in clinical trials at the moment. What this technology does, I first saw it about 4 or 5 years ago now. And you take, put an electrode on one part of the body and another electrode on the other, and it passes a low voltage current between the two, and it can actually determine the amount of extracellular fluid that you have in the limb or in the area you're measuring. And the more sophisticated ones now can even do that for a bilateral lymphedema. So before, what they were doing is they'd put it on the unaffected limb, and they'd put it on the affected limb, and then they could calculate the extracellular fluid levels between those two. Now they've got a way to calculate the difference between the fluids that are inside the cells in your tissue and the fluids that are outside your cells in the tissue. So they can in fact diagnose bilateral lymphedemas with this machine. The cool thing about this is it can calculate a difference of 5 milliliters in a limb. So it's very sensitive to the amount of fluid that's in the spaces, and I'm really looking forward to this. So you could, in the case of bioimpedance, it would be very easy to get pre and post-operative measurements of anything. You know, you just hook up some electrodes, run her through, boom, you got her. You can do it every time a client comes in after the fact. Early intervention. So we know you have lymphedema, or you're at risk for lymphedema, or in terms of bioimpedance, before you're even clinically, you're subclinically, at a subclinical level for your lymphedema, we can tell with the bioimpedance. What do? I'd like to talk about manual lymphatic drainage as an early intervention, because it stimulates the lymphangions to increase the rate of flow of the lymphatic system. And it removes fluid wastes, large proteins, fat molecules out of the tissue, and it diverts them away from the areas of known congestion. So if in fact you're radiated, you know, in the axillary area, or you're radiated in the inguinal area, with manual lymphatic drainage, you can actually move that fluid and waste laterally away from the inguinals in this case, take it up over the navel lumbar line where it's picked up by the healthy lymphatic system and taken off. If you can intervene early with this when you don't have a lot of volume already, some people have been able to show some dramatic results. The technique is very light. It's rhythmical, it's gentle. In fact, the pressure against your skin, if you're doing the stroke properly, is no more than the weight of a nickel. So if you think about putting a nickel on your skin, that's how much weight the stroke is having. There's some different techniques around with respect to it, but most of them follow Dr. Vaughter, who presented his first scientific paper on manual lymphatic drainage in 1936 in Paris. When I was trained in 1994 in manual lymphatic drainage, there was 600 therapists trained in North America, and there was 14,000 in Germany. We are way behind over here. We're third world as far as the Europeans are concerned about lymphedema and lymphatic therapies. The contraindications for manual lymphatic drainage are really important. Severe kidney disease, because we can increase the rate of lymphatic flow 6 to 10 times normal levels. We're putting a lot of volume through the kidney. And so if the renal function is diminished, we need to know that. Uncontrolled congestive heart failure is another one that's a contraindication. You can work with it. It used to be an absolute contraindication. It's now, you can work with it if you're really careful about how much volume you're moving and the person's controlled. But in the case of congestive heart failure, you've got a lot of fluid being produced already, and the heart can be overloaded by increasing the amount of flow through it. So you can kill somebody. Acute infection is another absolute contraindication because the lymphatic system moves antigens into the lymph nodes and ultimately dumps it into the blood supply. If you've got acute infection and we do an MLD session on you, we can spread that infection all over your body in no time flat. Another one's an acute thrombosis, deep vein thrombosis. You can actually dislodge them. You can move them so somebody could stroke on you. You can have all kinds of problems. And untreated cancers, unless you're in a palliative situation, because there's concern that there's metastatic cells in the lymph system, and by stimulating the increase in the amount of flow, you can in fact spread the cancer. I had a woman come to me one time, huge arm, had breast cancer, had been down in Mexico getting Laetrile, and wanted me to reduce her lymphedema. She had not seen an oncologist in North America, and in my view at the time was not fully informed enough to make a decision about whether or not she needed manual lymphatic drainage combined decongestive therapy. And I told her I would not be treating her until she saw an oncologist. Because I didn't want to put her, as I said to her, I said, you know, we're playing a real high-risk game here. You know, sure we can reduce your arm. I'm pretty confident we can get your arm down, but what's the point of doing that if now you got cancer somewhere else? So people that are doing this work have to be really cognizant of these contraindications. And that's why it's really important that if you're referring people for lymphatic drainage, or you have patients or friends who are interested in getting lymphatic drainage, that you ensure that they're working with somebody who knows what they're doing. Currently in this province and in the whole country, we're no different at all. There is a whole lot of people treating or claiming to do lymphatic drainage who do not know what they're doing. And unfortunately, that puts patients at risk. If you go onto the Massage Therapists Association website, you'll find 275 people identify themselves as doing lymphatic drainage. Most of them have had very little training in it, don't understand the implications, and don't even know what they don't know. So that's something we want to do something about. The way in which we're going about doing this, I sit on the education working group for the Canadian Lymphedema framework, and we've just been addressing training for lymphedema therapists. Now, this doesn't just apply to massage therapists, but there are nurses, physios, OTs working with lymphedema currently in this province who have no specialized training in lymphedema treatment. So it crosses, and in fact, one of the things we found when we looked at this whole area is that practitioners in the fields that are working in it are RNs, PTs, registered massage therapists, OTs, MDs, and not a single governing body or college has any educational standards with respect to lymphatic therapy, lymphedema. The Canadian Lymphedema Framework just adopted the National Lymphedema Network and the Lymphology Association of North America's standard of a minimum of 135 hours of combined decongestive training after you're in fact licensed in one of these areas. So it's a postgraduate specialty. And they're saying you need a minimum of 135 hours. And they'll accept whether, if graduates come out of a school that LANA already accepts, they'll recognize it as well. Currently, there are only 4 schools worldwide that meet that standard. So if in fact you know somebody who needs lymphatic therapies, you need to find a therapist that is either Vawter, Fody, Norton, or Cassie Smith trained. All the other schools do not meet that 135-hour standard. And we're currently presenting this standard of education nationally to the professional colleges, asking them to endorse it. And I'm hopeful that they will. You can bet there's going to be a lot of resistance. Let's talk about why I think manual lymphatic drainage is in fact an appropriate early intervention for lymphedema. There was a very interesting study done, and it was completed and published in 2012, so it's pretty current. It took a randomized control study of 67 women, starting on day 2 following their surgery. The control group received standard physiotherapy, exercise for the arm, chest, no manual lymph drainage. The trial group received manual lymph drainage 5 days a week for 2 weeks, and then twice a week from week 2 to the end of month 6. They were measured for arm volumes on day 2, 7, 14, month 3, and month 6. And what they found after 6 months is that women who did not get manual lymphatic drainage had a significant increase in arm volume. The p-value is 0.0033, so that's a pretty strong p-value. 70% of that control group got lymphedema in this study compared to the volume at the start. The women who did receive manual lymphatic drainage had no significant increase in arm volume. Not a single one of them. Regardless of the type of surgery and the number of nodes removed, MLD was effective in preventing lymphedema in this study. And even in high-risk breast cancer treatments where they had surgery and radiation, manual lymphatic drainage was effective against arm volume increases. Obviously, more studies needed. However, I'm of the view that manual lymphatic drainage administered early after breast cancer treatment, and I think after any intervention like that, whether it's breast cancer or it's gynecological cancers or whatever, should be considered to prevent lymphedema. Here's the one we all love. Self-massage for patients. We teach it all over the place. Why do we do that? We claim to be evidence-based, and we try to be evidence-based. There is no evidence with respect to this being effective. In fact, there's one study out there that was done in 2002 by Dr. Mortimer and Franks are very famous physicians in London, England, at the University of London. And they did a study where they did a modified version of manual lymph drainage. They called it simple lymphatic drainage, where they taught patients how to drain their arms, and as a self-help measure. And then what they did is they explored the effects of manual lymphatic drainage compared to self-lymphatic drainage in terms of a range of outcome measures. And the findings demonstrated that manual lymphatic drainage significantly reduces excess limb volume. It found that it significantly improves quality of life in terms of emotional function, sleep disturbance, altered sensation, pain, heaviness. It produced a significantly statistical reduction in limb volume. But following self-lymphatic massage, there was a non-significant mean reduction in the excess limb volume. It didn't change anything. Manual lymphatic drainage was found to significantly reduce dermal thickness at the deltoid site in the upper arm where they measured. Self-massage did not. They did a questionnaire, a self-report with respect to emotional function in terms of reducing worry, irritability, tension, feelings of depression, found that manual lymphatic drainage improved all of those. Oops, what did I just do? I better not do that. It also improved sleep disturbances. Self-massage did not result in any significant changes in any of the quality of life parameters. None whatsoever. The self-reported questionnaire showed that MLD was significantly more likely than self-massage to improve pain, discomfort, heaviness, fullness, bursting, and hardness. Basically, self-massage does not do anything. It does not help the patient, and I really question why, in fact, we're suggesting people do it. In my less politically correct moments, I call it busy work for patients. I think there's a whole lot of other things that we can instruct people to do that are much more effective, and I'd like to talk about those. Prevention of infections is a real important one, and Dr. Rao will talk about that more importantly, how it damages lymph vessels and increases lymphedema. To prevent cellulitis, it's really important to avoid cuts, scrapes, insect bites, to wear protective gloves and shoes. Avoid blood tests in your affected limb. Today, in this city, people still want to do it. If lymphedema patients often go into diagnostic clinics and nobody's instructed them not to put a needle in their affected arm. They have problems with surgeries with respect to anesthesiologists wanting to put, catheters into that arm. Don't do it. Also, avoid acupuncture in the affected limb. Not because the needles aren't sterilized, but because the needle provides an opening in the skin that allows the bacteria, which exists on our skin all the time, a point of entry. And if you're at risk for lymphedema or have lymphedema, it is really important to avoid those kind of situations where you can allow access. Avoid sunburns. Be really careful with manicures and pedicures. Make sure people's instruments are really sterile. Make sure they're really good manicurists and pedicurists. Forget the industrial variety. You save some money, but you don't want to spend the next 10 days on intravenous antibiotics either. Practice good skin care. You want to take care of breaks in the skin, any cracks. And seek medical advice immediately for any skin redness at the at-risk or affected limb, or if you're getting any chills or flu-like symptoms or fevers. You may in fact get those kind of things before you get a lot of redness or rash. But if you do have some redness or rash, don't overlook it. Intervene really early. The other thing we advocate is wearing compression garments for air travel. Avoid lifting heavy weights repeatedly, and I'm going to talk a little bit about exercise as we go along here. So with respect to this one, I would say the reason I say doing that is because it's a rapid, short kind of movement that you don't work up too slowly, so it can cause a problem. Stay out of hot tubs, hot baths, and saunas. The reason for that is all of those things increase fluid filtration into our tissues. And you've already got a situation where you've got a disrupted lymphatic system that's overloaded. You don't need more fluid. And seek early medical advice for any swelling. How much precaution? If you've just got a lymph node dissection, the precaution can be fairly minimal, but sensible. The more damage you've had to the lymphatic system, the more complications that exist, the more precaution you need to take. Control your body weight, as I said earlier. Remain active. In my view, get regular manual lymphatic drainage or combined decongestive therapy. Get rid of that edema as quickly, as fast as you can. Good care of skin and nails. Optimum body weight, eat a balanced diet, avoid injury to the at-risk area. Avoid tight underwear, clothing, watches, or jewelry. 70% of the lymphatic system, if you recall last week, is in the top 2 layers of the skin. So if you're wearing really tight shorts, you're restricting lymphatic flow. Exposure to extreme heat or cold. Use sunscreen, insect repellent. First off, I'd say with this one, use mosquito nets if you're in lymphatic filariasis, edematous areas. If you're at risk for lymphedema already, stay out of there. Don't even go to those countries. You need compression garments if prescribed. You need to undertake exercise, movement, diaphragmatic breathing, comfortable shoes, those kind of things. So these are basically the 5 areas that risk reduction happens in. You know, skin care, your activity and lifestyle, avoiding limb constriction, compression, extreme temperatures. I think we've pretty much covered those things already. Why we say be cautious with repetitive stretching kinds of exercises like vacuuming, painting the walls, golf, bowling, because you can further damage the lymphatic system by overstretching an already sensitive area. Air travel, lots of debate around this one. I tend to say, let's err on the side of caution. With changes in pressures as you ascend and descend, people that are at risk, especially in flights over 3 or 4 hours, have a problem. Lots of clients that I've seen don't have a problem in terms of travel, but many people report that their edema was first triggered after a long flight. So why risk it? And if you already are at risk for lymphedema or have lymphedema, make sure you're wearing compression while you're flying. Understand your level of risk. And if you experience things like achiness or heaviness in the at-risk limb, consult a lymphatic therapist prior to a long trip. With some of our clients on the VODR site, they've got international therapists listed for all over the world. So I've made arrangements lots of times for people to get a MLD session, combined decongestive therapy, when they land in Singapore. You know, they're going to be there for a while, or they're in Australia, or they're in Korea, or they're in Europe somewhere. Those kinds of things can be arranged so that you can get therapy on each side. The National Lymphedema Network, which is a US-based organization, says given that there's little evidence in the literature regarding many of these practices, they're really based on the pathophysiology knowledge that we have and the experience of clinical experience of experts in the field. We need a great deal more study to verify these things, but at this point, this is the best guess we got based on what's knowledgeable about the physiology of the system. The inability to reliably identify risk factors, however, really frustrates patients. You know, it's not great to hear there's not a lot of information, people don't know a lot about this, we think this is what's going on, and it fosters a lot of fear and frustration. I'm going to skip that one because we've pretty much covered this. If you're at risk for lymphedema, be sensible, exercise caution where needed, maintain a healthy lifestyle. Don't spend your life in fear of lymphedema. It can take 20 years or more to develop, or it may never develop. If you're at risk for it, be cautious, but get on with your life. If you have it, seek out treatment, don't ignore it. Become an active partner in your treatment. Don't become discouraged. Be cautious of your limb, but live your life fully. Accept your limitations, but thrive. And do not look at lymphedema pictures online. That is not you. Yeah. And you know, you don't want to go down that road, and you don't have to. Lymph taping is another area that has been coming into the fore lately. What that is, it was developed by a PhD in physiology in Japan about 20 years ago. You probably might have noticed it at the Beijing Olympics. A lot of people were wearing tape on their shoulders or on their knees, and you know, they were doing all this stuff. What that was is called kinesiotape, sometimes called leukotape. It's basically a lymph tape, and I think Pauline's going to talk a little bit more about that and maybe show you some pictures of herself. But basically what this does is it stretches the skin. Remember the 60% to 70% of the lymphatic system in the top 2 layers of the skin? When you apply this, you apply it with a slight stretch. And what it does is it pulls the skin away from the underlying tissue and stimulates the lymphatic system to move, and actually stimulates lymph flow. And there's one study that has shown that it was pretty much as effective as a compression garment. We use them under compression garments or under bandaging. When people don't tolerate compression, we'll use them for sure. In problematic areas, we'll use them, such as a hand. One of the things that's important if you're going to go out, don't just go out and buy a roll of kinesotape or leukotape down at, Healthcare Solutions or something and try putting it on. Get instructed on how to do it first, because you are in fact going to be putting it in a way that it promotes drainage to where you want it to go. So you want to have somebody instruct you with respect to that. You need to understand the lymphatic system, the lymphatic flow, where your problems are, and how the application might work best for you. Don't overstretch the skin or the tape over the skin. It can cause blistering. You want to be careful with fragile skin or really early healing tissue. You don't want to apply it over that because you can pull it off. You want to be really careful over radiated areas because these can be really fragile tissues as well, and they can be stressed. You don't want to put it over newer or known cancer sites. You don't put it where there's cellulitis because you don't want to promote that moving. And you don't want to apply it over an open wound. But we often apply it beside wounds or up to the edges of wounds in order to promote the reduction of drainage out of the wounded area. And you don't want to put it where there may be a blood clot. And you want to be careful if there's any allergic reaction. I've rarely seen anybody have an allergic reaction to the tape, but it's possible. Nutrition, obesity, big risk factor. And many people find that even a loss of 5 pounds can improve their lymphedema. So even small losses of weight improve the actual limb volume reduction. You need to calculate BMIs, and BMIs greater than 30 should be referred to nutritional advice. Hip to weight ratios are very important in terms of health concerns. Exercise, remedial exercise, aquatic lymphatic exercise, swimming. Swimming is a wonderful exercise for lymphedema. The reason it is, and I don't even mean just swimming up and down the pool, what I'd like people to do more than anything is get in the water up to their neck and bounce around a little, move. You don't have to swim. You can walk around. You can tread water. You can do whatever. For every centimeter below the surface of the water, the pressure increases 0.069 millimeters of mercury. What that means is by the time you get neck deep in water, the pressure on your feet and lower legs is higher than any compression garment you can be prescribed. So you are now in a compressed situation where you are gently, rhythmically moving, which stimulates lymphatic flow. So if you want to tell patients to do anything, save the time doing self-massage and get in the water, because that's where you're going to get the real benefit. Here's some people doing it. There's been some studies by Tildar out of University of McGill, or McGill University, on this, and I can't overemphasize the importance of it. Exercise is beneficial to lymphedema patients. It's better if you're doing circuit or interval training with some short rest periods. You need to wear your compression garments while you're exercising to discourage pooling of the fluids, because the lymphatic load is increased when you're exercising, but it's offset by that. So if you've got your compression garment on, you don't have to wear your compression garment in the pool, however, because you got lots of pressure from the water. Improving flexibility is really advantageous to reducing lymphedema, especially pecs and traps and stuff for breast edemas. Yoga, Tai Chi, Qigong have all found to be useful. The caution I have about particularly yoga is that you don't want people in an isometric contraction for an extended period of time if they have lymphedema. The important thing about exercise with lymphedema is that you are moving. You're moving through a range of motion. It's gentle, it's rhythmical. If you put somebody in an isometric contraction, you're going to further limit their lymphatic flow. So I really think that you got to be careful. If you've got an arm edema, don't be doing downward dog. You know? So it's important that you think about the kinds of exercise that you're doing. One trial showed that a variation in tissue pressures brought about by variations in muscular tone increased the pressure gradients in major ducts, and also showed with changes in respiration that they significantly reduced arm edemas. That was done in Australia actually by Neil Pillar. Muscle strengthening. This is one that everybody wonders about, you know, and I said earlier, don't be lifting heavy objects. I still stand by that, but if you undertake strength exercises and do so on a graduated basis where you're moving up slowly, you can in fact do fairly high intensity exercises as a lymphedema patient and not harm yourself. And there's been some good studies of that. Of people doing it and not having any problem with it. In this case, they wore sleeves. They did stretching and aerobic warm-ups, and then the resistance training was 3 times a week, low sets, reps, and low weights, and they progressed slowly. This was a really big study that was done, and it showed looking at high resistance and moderate resistance exercise. So they were doing a lot of heavy weight to see whether or not it affected lymphedema. And the finding of the study was that there was no lymphedema exacerbations or adverse effects that occurred during the trial. So lymphedema patients can be active, they can lift heavy weight. What I tell clients that I see is you just need to go slowly. You need to take like 4 times longer than anybody else to get your weight up. But you can get your weight up. I saw a presentation by a woman who had a leg edema, and she had just won the CrossFit competition in the US. She was doing high intensity exercise repeatedly every day, and she was wearing her garment all the time, but her lymphedema wasn't bothered by it. So the conclusion of this study, which was a breast cancer study, is with breast cancer-related lymphedema, you can safely perform moderate and high-intensity upper body resistance exercises with both high and low loads without fear of exacerbating your lymphedema. It was an excellent study. Cardiorespiratory exercise, aerobic exercise, again, it's really good, increases blood volume to the entire body. You want to make sure you're wearing your compression again, because you're increasing your respiratory function, you're increasing that Venturi effect that's drawing the lymphatic fluid through, and it improves flexibility of the rib cage, improves lymphedema. That's it for me. Any questions? Clear as mud? Yes, ma'am.
When you treat cording, do you ever use myofascial release with cording?
Do I use myofascial release with cording? No. One of the things that's found to damage the lymphatic system more than anything else is shearing pressure. Okay? So you want to be really careful that you're not stretching the tissue beyond its capacity to stretch, because then you're tearing the lymphatic tissue. When you're doing myofascial release work, you're actually breaking the adhesions between the fascial layers. There's some thought that the lymphatic vessels are running between those fascial layers. So, you know, I don't want to be doing myofascial release work in an edematous area. Any other questions? Sir, ma'am.
You were saying that the self-manual isn't good, but how does a person get rid of the fluid when you have it in so many parts of your body?
It's a challenge. We talked a little bit earlier, and I was going to address it and forgot to, in terms of, okay, if you've got a double radical mastectomy, where do you drain to? Where you drain to, actually, is you drain laterally to the back, where the lymphatic system's healthy and can be picked up. You drain up over the clavicle into the supraclavicular area up here.
Well, I've had radiation in there.
On both sides?
No, just the one.
Then you got to go to the other. Yeah, you cross the midline and take it over. Okay?
If you had lymphedema, or if you were at high risk for developing lymphedema, would regular deep tissue massage, the kind of massage that a lot of people get, would that be contraindicated or in any way harmful?
Yeah, my mind, let me qualify it a little bit. On the areas of your body that are not at risk for lymphedema, deep tissue work is fine. In the areas where your body is at risk for lymphedema, don't let a massage therapist touch you deeply in that area. Because what they're doing is, they're not only they're compressing the tissue, but most massage therapists will tell you that massage helps to drain the fluid in the tissue. It's wrong. It's actually totally wrong. What it does is it increases the rate of filtration from the vascular system into the tissue, increases the lymphatic load, actually. It doesn't do anything to drain. Manual lymphatic drains, drainage massage drains, because it creates smooth muscle contraction and the Venturi effect that draws the fluid out of the tissue and creates the actual vacuum that's necessary to move it. But actual deep tissue massage increases the amount of tissue fluid. So no, don't get massage on areas that are at risk. Don't let them touch you.
How do you determine problem on your torso?
I guess you'll feel it the same way you do or you will for an arm or a leg, you know, in terms of a sense of restriction or heaviness or loss of sensation, or it's puffier, or the tissue's denser there. You can feel that. You have some restriction in terms of your movement or your range, or you'll just have a sense of it sometimes. People pick it up way faster than therapists pick it up.
Okay, thank you.
But that's a good question also to ask Pauline when she gets up here.
Okay.
I'll get the one in the back first.
Can people have manual drainage then if they are just finishing chemo and then still have radiation to do, or do you suggest it post-treatment or during?
I like to talk to their oncologists. Because, you know, that's a question I don't really have a general answer for. It's really specific to the nature of the cancer you're at and the progression that they're doing of your actual situation. I've worked with oncologists and patients where we've actually done manual lymph drainage during the chemo. Because if you think about it, the point of chemotherapy is to put the drug in contact with the metastatic cell, with the cancer cell. So if you increase the rate of lymphatic drainage and you move more fluid into the system and through the tissues, then you actually increase the exposure that those metastatic cells have to the chemicals, and therefore you should probably get a higher kill rate that way. Some oncologists are thinking that way, some aren't thinking that way yet, so I think it's something you have to really talk about.
I've seen Guy Lafleur on TV advertising a machine for stimulating his leg circulation.
Okay, was that the one that shakes them? Yeah.
Well, I don't know if it's shaken or not, but are those things any good?
They did, Dr. Neil Pillar at Flinders University in Australia actually did a study on a machine called a Chi machine. And it's a little machine where you put your legs in and it vibrates and kind of shakes you. And they looked at some other little vibration machines. They actually found a statistically significant reduction in lymphedema as a result of using them. So, yeah, I think there's some benefit to them. I've got some clients that report some benefit of them. So, yeah, well, Guy's not too far off this time, maybe. Alrighty? We're done. Anything else you want to know, ask Pauline.
It's my great pleasure to introduce Pauline Mitchell, and I've known Pauline for about, since 2008 when she joined us here. Pauline is a nurse, a registered nurse, and she graduated from the University of Alberta with her degree in nursing. She has specialized her specialty practice, and her strong knowledge base is in neuroscience. And she worked at the University Hospital in the neuro ICU. She'll tell you a little bit about her transition into MacEwan and why she came to MacEwan, but I'm so glad she did. She is one of the faculty that work with us in the Centre for Professional Nursing Education, and she is extremely good at her job and a delight to work with. She's the mother of 3 great kids, and she was diagnosed and successfully treated for breast cancer in 2005. She developed lymphedema in spring 2006, and so her journey begins. And so please welcome Pauline.
Well, as Shirley said, my background is as a nurse, and I'm coming to you today as a patient with lymphedema as well. So when Ian first was talking about these patient education sessions, he asked me if I would speak. And I kind of thought, well, I don't know that I should speak. I don't know that I know anything more than anyone else who's in this room. And he said, you know, I think you do because you're a nurse. And well, I knew, being a nurse, I certainly didn't know much more than anyone else. Like Ian has talked about, like the doctor talked about last week, as a nurse, I really didn't learn a lot about the lymphatic system and lymphedema in my nursing program. So I actually didn't come to the plate much more informed. So anyways, Ian's been very good to me, and I thought, I've got to help this guy. He's advocating for lymphedema patients all the time. How can I say no? So I agreed to do this. And I said to him, but like, what am I talking about? He said, you're going to talk about how this has affected your life. You're going to talk about the psychosocial impact of lymphedema. And I'm like, oh. See, those are kind of things I like to bury. I leave them in the closet, and I try to ignore that I have lymphedema and go on with my everyday life. But again, I told him I'll do this, I will do this. So he provided me with studies and some slides, and I looked at them and I thought, oh my gosh, this is very depressing what I'm dealing with every day. I'm not sure I want to stand up and talk to people about this. Anyways, but again, I pulled back, I reflected, and I thought, you know, I need to look at this. I need to think about how this has affected my life. So I already was having a journey with lymphedema, but when I delved into all of the studies and all of the documents about how much this impacts my life, I kind of have gone deeper into my journey of lymphedema and understanding what this actually has done to me and how it has affected my life. And I get through a lot of things in life by being positive. So to stand up here and list everything off that lymphedema does to you or can do to you is not the way I do things. I want you to leave this room tonight with hope. And so I decided, well, you know what, I'm just going to tell my story. So I'm not going to have a bunch of research and dates. I'm just going to tell you about my journey. And I think in my journey, you will find that there's a lot of things that are very common to every patient who experiences lymphedema. I'm coming to you as a breast cancer survivor, and I have cancer-related edema, but I know there's many people who have other types of lymphedemas. And some people have talked to me and identified it's frustrating. You breast cancer people get all the studies, you get all the information, it's all about you. And you know what? They're kind of right, because we're the biggest group that's impacted by this. Having said that, if they learn something from people like me, it will benefit everybody. So don't be mad at me. Anyways, I hope my story will be beneficial to you. So this is the story of my journey with lymphedema. And even the other day, Shirley asked me about my bio so she could introduce me. And I'm like, well, what do you want to know? That I'm a nurse? Or do you want to know that I have lymphedema? Like, I'm not sure really yet how I'm approaching this. And she said, well, Pauline, you have to tell me both, because it really has changed how you have dealt with this. And again, I had to reflect and think, you know what? Being a healthcare provider really enabled me to deal with my lymphedema a little bit different than the average person would have. So there's a lot of truth to that. I'm bringing something from both sides of my journey, I hope. Let's see what you think. Okay, so my journey began where it needed to at the point of diagnosis. Sadly, that's the first challenge. I had one arm that was bigger than the other. So I was lucky. I was still receiving treatment at the cancer clinic. So I had an appointment scheduled that week, and I went to the radiation oncologist. We talked about my therapy that I had completed, and I asked her about my arm. And I said, I think I need to see the physiotherapist here. And she said, you don't have lymphedema. Your arm is not swollen enough. That's not lymphedema. Well, I felt relieved. Thought, well, that's good to know. But I'm driving home thinking, I still have one arm bigger than the other one. This can't be right. So I was already involved with a physio team because I lost a lot of arm function after my surgery. And I was talking to my physiotherapist, and I was starting to think, am I a little crazy? Like, does this look bigger to you? I'm saying to her. And she said, you know what? It does. And she measured my arm, and she said there is a difference in size. And she called a contact she had in the physio department at the cancer clinic. And they said, she needs to come. She needs to be seen in our department at the Cross. So she says, great, how do I get her there? Well, she needs a doctor's referral. Okay. So again, I'm back. I have to contact my family doctor now. And I'm, again, fortunate. I have a good rapport with my family doctor. And he says, whatever you want, whatever you need. He refers me to the cancer clinic. And I start my treatment there. So the first part of diagnosing was a lack of knowledge of healthcare providers. My family doctor really didn't know. He just trusted me. And he listened to me when I said, I shouldn't have one arm bigger than the other. That did not seem like rocket science to me, right? And I knew I'd had breast cancer surgery. I knew I was at risk for lymphedema. But I wasn't told a lot about it. I was told that there was a risk, but you know what? Probably won't happen. About 20% of women will get it. Well, as I've learned a lot about lymphedema, I realized, you know what, probably my chance of getting lymphedema was a little bit higher than other people because of the type of surgery I had, and I also had radiation therapy. So I was not that alerted myself, nor were the people that were caring for me. I was shocked, and I still kind of am, to look back and realize that I was talking to a doctor at the cancer clinic. They must see more lymphedema than any other group of physicians. And they didn't think I had it because it wasn't bad enough. And I think as patients, you know, we really have to advocate for ourselves, and we have to believe this is not normal, and you have to push. Squeaky wheel gets the oil, and you will hopefully get the care that you need. So I would ask any healthcare provider out there to acknowledge a patient's symptoms. If they come to you and say, things just don't feel right, pull back and listen. Because nobody knows what their body is doing better than that patient who is describing the symptoms. So I got diagnosed, which was good, because then I was allowed to have treatment. And it was interesting. During this journey, I kind of knew something was up. I had a friend who was a massage therapist, and she had told me about Ian before I ever got lymphedema. And she said, you know, you should maybe see him before you ever develop this problem. She's saying, I've heard that's good, Pauline. And I'm like, oh no, I'm good. 20% chance. My arms are the same size. I don't have lymphedema. I'm good. So once my arm got bigger, I also called Ian. And when I was talking to Ian, he told me over the phone, you absolutely have lymphedema. I can tell you have it because of the way you're describing it. I don't even have to see your arm, he told me. You know, that really validated me. Okay, I'm not crazy. It appears there is a problem here. It sounds like there's a problem here. And he said, but you need to get to the cross to be diagnosed. Because if I tell people that you have lymphedema, they're not going to recognize me. They're not going to recognize that diagnosis. It won't stay on your chart because they're going to say, who diagnosed you? Ian who? You know? But if you're diagnosed with the right group of people at the cross, through the physio department, it becomes a part of your chart. Now I'm Pauline Mitchell, breast cancer patient, lymphedema patient. And it's part of my history. It might not have been part of my history if I didn't get to the right place. So I've learned over the years to straddle our two healthcare systems. I straddle the public system, okay, because that's what treats me. That's what treated my breast cancer, and that's who had to diagnose me. They're the ones who have to prescribe my compression garments. They provided me with decongestive therapy at the cross, where I was wrapped with short stretch bandages. I've been wrapped with Coban. They've done a lot for me at the physio department at the cross. They taught me self-massage. I had early lymphedema. It was mild when I was diagnosed, and they thought this would help. Well, I wasn't doing it too long, and I thought, I don't know what the hell I am doing. I'm at home at night thinking, is my arm supposed to be up? I didn't know. I didn't know how to tweak it. I didn't really know if it was working because I didn't get to go back and be reevaluated. So pretty soon I stopped doing that. And I had talked to Ian, and I had started to see Ian, and I started to receive manual lymph drainage massage. So now I'm in the private system. So when I was seen at the cross, I was treated with with compression garments only. My edema wasn't large enough to warrant manual lymph drainage massage or decongestive therapy wrapping, and my arm was not huge at diagnosis. From the time I saw my arm swelling in the spring to when I was treated was 6 weeks. So early, because I was on it, and I was that squeaky wheel saying something's wrong, someone needs to listen, or I'm just going to keep coming back. So I was treated early, and but I didn't need to be wrapped because my arm wasn't big enough. So any wrapping I had done initially was from Ian, because in the public system I kind of didn't fit the criteria. I didn't fit the protocol. I wasn't bad enough, which is realistic, right? They have to judge things somehow. They have to, you know, determine who gets what therapy and who doesn't. The therapists there don't have an hour to be massaging your arm. So anyways, I have been fortunate enough that I've been able to afford to use the private system. I believe the therapy that I've got through Ian's clinic and the manual lymph drainage massage has allowed me to maintain a pretty reasonable fluid volume in my arm. But you have to navigate both systems. I had to be diagnosed. I had to get compression garments. And I have been fortunate enough that I've been able to manage a lot of my symptoms through the use of the private system and private manual lymph drainage massage. The other problem that I have, and everybody's story is different, I have a chronic back problem, and so my back is in spasm a lot. When my back's in spasm, my lymphatics are getting really flattened, and so my lymphedema gets worse. So I use physiotherapy to keep me moving, to keep those lymphatics moving, and to keep my symptoms at bay. So the physiological impacts of lymphedema, you know, it really depends on the person. It's very individualized. You can't just look at someone and say, they have mild edema, they're fine. Wow, that person has a huge leg. It must be really significant. It must be impacting them, because we all deal with things very differently. So it's very individualized. So I don't think it's really connected per se directly to the severity of the lymphedema. Obviously, the worse the lymphedema, the more it's going to impact your lifestyle and your ability to be involved in physical activities. So again, it depends how active you are to begin with. Was that something you lost? Did you golf all the time and now you can't? So it really does depend on the individual and the story they bring. Your ability to do your activities of daily living. You know what? If you didn't like doing housework, now you have lymphedema. It all works out. So, you know, it affects everybody individually, so I think it's really important as healthcare providers and for you as a patient not to feel bad that it's hard for you. Please don't judge people. If they come to you with an arm that's swollen and to you it's mild, you know, it's important that you don't judge them because you don't know what it brings to them. So I think when you look at me, I don't look like I have a really severe edema. I've worked hard to manage my edema. But if I tell you, well, you kind of know from my history, that I was a nurse and I worked in a neuro ICU and I loved my job. But now I'm a nurse who works in a neuro ICU who has lymphedema. And I need to wear a pressure garment. I can't wash my hand. I need to protect myself from harm, so I can't be around really bad bacteria. And I also can't really lift patients like I used to be able to because it's a little bit hard on my arm. So being diagnosed with lymphedema changed the kind of nurse I was. I was very fortunate that I was involved in education and I was able to transfer over and continue to work. But if I didn't have my foot in that door per se, this could have really changed my ability to work. When I was first diagnosed with lymphedema and I was still off getting cancer treatment, I had to go to some short-term, long-term disability interview. And I remember the girl saying to me, well, you're never going to work again. And I said, what? She said, well, you're never going to work again because you have lymphedema. And I'm like, really? Does that happen? Like, because, you know, I didn't really know that. And I'm thinking, that's not going to happen to me. That's kind of person I am. So she said, less than 2% of people who've had your kind of illness and who have lymphedema will ever return to work. I said, what did you say? She said, less than 2% of people. So I don't know where she got her stats from. But you know what? They motivated me. And I thought, to hell with you, lady. Anyways, I remember, so within about 6 months, I went back to work. I did work in the neuro ICU for a little while, but my lymphedema and the management of it was what brought me to MacEwan in the end, because I'm able to teach, I'm able to be a nurse, but maybe it's not the kind of nursing I love, no offense, Shirley, but you know, I really loved what I did. And no one would know that looking at my arm. You would think, oh, she's fine, she's functioning well, whatever. So it's very important not to judge what this has done to someone's life, because you have no idea what it's done to their life. And you need to let them tell you the story. You need to find out the impact it's had on them. So there's also a financial impact to having lymphedema. My financial impact would have been quite huge if I couldn't go back to work, and I believed what that lady told me. But there's a universal financial impact because you need to wear compression garments. Compression garments cost money. We are very fortunate in this province to have some coverage through aids to daily living, but it doesn't cover the whole garment. But still, I'm grateful. Ian was telling me the other day, was that Manitoba you told me about? Quebec. One pressure garment is funded a year. One. Well, it's hard enough to keep the 3 that are now stretched out of shape, and you got to wash every night and all that stuff going. I can't imagine one pressure garment a year. So you have to pay for compression garments. If you choose, like I do, to have manual lymph drainage massage, you have to pay for that because that's not funded in the public system. You have a loss of personal time. I have cut back the hours that I work because I spend so much time between Ian and physio and other appointments that I have a day a week that's an appointment day, where I'm at the cross, where I am at appointments, where I'm being measured for garments, whatever. It does eat up your personal time. So if I had to work full time, that would be difficult. And I've told you my story about my employment. So, you know, you think if I was a painter who painted overhead and I got lymphedema, that'd be a real problem. I tried to paint this year, our house. I said to my husband, I can do this, I can help you. Anyways, I didn't help him much, and I spent a lot of time at physio and seeing Ian because my arm was quite unhappy with me holding it up and trying to paint things. So, you know, there is a huge financial impact to the diagnosis of lymphedema, and I think we underestimate that. And, you know, it's unfortunate that treatment like manual lymph drainage is not a universal treatment, that it's not funded for everybody, and that it does come out of your pocket. So when I look at the things that I do for my management of my lymphedema, I, on average, spend, and it's a average because it got really depressing when I started to look at all of it, I spend about $300 a month. And that's between, I see Ian every 2 weeks for manual lymph drainage. You throw pressure garments into that. I use taping, and I see a physiotherapist. And I see them all a lot. So there's a lot of money. So anyways, I'm fortunate that I can afford that, but it does make me wonder, what about the people who can't afford that? Should they have any different level of care than me? I don't think they should. And I know that we're learning about lymphedema. And I truly believe that this will change, that we will start to see outcomes, and that somebody's going to be happy with the quality of the study that was done, and we are going to start to fund things. But I'm sure any of you who have pressure garments know that when you try to get funding for the remaining portion of your garment that's not covered by aids to daily living, Blue Cross, things like that, don't cover any of that money. If it's a splint, they'll pay for it. But if it's not a splint, they won't pay for it. If it's a compression garment, there's no extra money to be had. So if you're an older person, and when I look at, say, the statistics with breast cancer, the majority of women that get breast cancer are over 50 years old. So if I'm an older person, say I got this when I was 70, I'm on a fixed income, it can be pretty significant, the costs that I have to endure to manage my symptoms. Body image and self-concept. You know, I try not to think about that, but because I did this presentation, I had to, right? And I started to think, you know, that's so true. It's hard to deal with lymphedema because it's visible. If I had diabetes, no one would know. But people know there's something wrong with my arm. I am one of those people that likes winter in Alberta because I put on my coat, I put on my mittens because gloves don't fit me anymore, but I put on my mittens, and nobody knows that I'm different than them. I can go to my son's hockey game and I'm just like everybody else. No one's asking me, what did you do to your arm? Right? Now, spring, summer, I go to soccer. I always wear like a jacket or something because I am conscious of my sleeve and my arm. But after a while I get hot. Taking things off, sure enough, people ask, what'd you do to your arm? And you know, if they're asking me what I did to my arm, they're asking my 13-year-old son, what did your mom do to her arm? And you know, he doesn't want to tell them she had breast cancer. Like, you don't want to go those places when you're 13. And you know, for a long time, I didn't go to those places. Depending on the day, I just didn't want to tell my story. People would ask because they were concerned. They would say, you know, what happened to you? Do you have carpal tunnel? Get that a lot. Yeah. Some days I had carpal tunnel. Whatever. Depended on what I felt like talking about. So one day I was driving through Tim Hortons, and anyone that knows me knows I go to Tim Hortons a lot. And I live in St. Albert. It's a small, well, not that small, but smallish city. So I picked my son up from kindergarten, and he was in the back seat, and I drive up to the window. And there's a lady there, nice lady, being friendly. Oh, what happened to your arm? She says, is it a burn? I said, it's a burn. I just want my coffee, lady. But, so anyways, I tell her, yes, it's a burn. Oh, well, good luck. I take my coffee, I'm driving away, and I hear a little voice who says, Mommy, you lied. You didn't get burned. You have lymphedema. Like, great. And you know, I thought, why did I say that? But you know, I just didn't want to deal with the whole thing. And I'd had times before you tell people you have breast cancer, they're telling you their grandma had breast cancer, she's dead, you're like, great, give me my coffee. So sometimes I didn't want to go there, but since that time, I just tell people I have swelling. That's all I say. And most people get that you don't want to give more than swelling. And you know, that lady worked at Tim Hortons during the day at that drive-through till about a year ago when she retired. And she'd say, how's the burn? Good. I never told her. And you know, my husband, he laughs at me sometimes. He says, you know, Pauline, there's people that probably say, I heard it's carpal tunnel. I heard it's a burn. And some people, I heard it was breast cancer. So, you know, you gotta watch what you say because it comes back to haunt you. Anyways, so it is visible and it draws attention to you, and you have to deal with that. And sometimes I'm dealing with the diagnosis of breast cancer, sometimes I'm dealing with the presence of lymphedema, but every day I'm dealing with the fact that I do look a little different. I've been able to distance myself from breast cancer. You get treated, you leave it, you walk away. It's there, I have to think about it, I have to be respectful of it, but it's not with me like this arm every day. So then that takes you to the place of clothing. So trying to buy clothes when you have lymphedema is a challenge. And it's probably less of a challenge for me than a lot of people. I can still get my arm into some wide garments, and I still try to cover my arm as much as I can. But you know, it's a challenge. People will like say to me, oh, you know, did you go shopping? Oh, I don't go shopping much. My middle daughter is graduating in a month, and she said to me today, you are really going to have to go find an outfit. And I'm like, can't I wear what I wore to your sister's grad? It fits. But, you know, I don't like to shop. I don't like how clothes fit me. I tend to buy clothes that are bigger than my size because my arm fits it. My clothes pull to one side. So, you know, it is small stuff, but every day kind of grates on you. And, you know, I'm lucky. I'm not dealing with a bilateral edema. I'm not dealing with having to get pants to fit my leg edema or shoes. I can't imagine how hard that would be. So when you look at the literature, they do talk a lot about isolation that's created by having lymphedema. Some studies say that no, it's not prevalent, others say it is. But if you pull back and you think about what that isolation means, you know, there is really a lack of understanding about what lymphedema is. And that starts often with your doctor. He doesn't understand it, so sometimes he can't offer you any solutions. You certainly have the general public who doesn't understand, who's asking you what's going on. Oh, have you tried this? You should try acupuncture, it works. You know, or you should get hypnotized. I've had a lot of suggestions of how to cure things, and again, people are being kind, but people don't understand what lymphedema is. And I get that, because you know what? I didn't understand what lymphedema was. So the management and the management of lymphedema and the impact of having lymphedema can be seen as a burden. And I've learned, and even doing this presentation made me pause, pull back and say, what has this meant to you? How has this affected you? And you know, it's hard. It's hard every day. But you can't live there. You got to move beyond it. There are some quotes that Ian gave me. And it was from a presentation. And so this is a quote from a patient that talks about, yeah, emotional, I have my days. Like, you know, I think in a way the lymphedema was harder to deal with than the cancer. Because the cancer, of course, you're going to hope that the treatments and everything work, and then it's over and done with. Whereas lymphedema, it's not over and done with. It requires a lot of care. The other thing I've learned on a personal level is that your lymphedema, it's chronic. I'm always going to have it. I get that. But it's changing. It's a very dynamic illness. I'm quite different than I was when I was diagnosed. For me, I've become worse. Other people can become better. But you have to realize it's a cycle. You're going to have good times, and you're going to have bad times. And you need to seek the treatment that you need to deal with that variation. This was another quote that talks about the anger sometimes that you can feel, the frustration. I would like the government to cover the cost of the sleeve and a glove if necessary. Whatever is necessary for lymphedema. It's an illness, and it's related to the cancer. Cancer's covered. It's not because I chose to have my lymph nodes removed that I developed lymphedema. I definitely feel that the government should be doing more than what they're doing. And I think it's time that the government did recognize it as an illness. And I can tell you, I don't think there's one person in this room who has lymphedema that doesn't feel that way. So all of that is part of being acknowledged. So this was a slide, again, that Ian gave me. It was the first slide I looked at when I started to develop this presentation. And I thought, wow, there's not one bit of goodness on that slide. And even the arrow made me think of a downhill slide. So that's why I didn't start with this. But I want to take you back to it, and I want you to think about all of the things that lymphedema can do to someone's quality of life. It does decrease your self-concept a little bit because you're concerned about your self-image. It can lead to depression, anxiety, occupational restrictions. You certainly do get altered limb function and mobility. You get pain and discomfort. And you know, there is decreased social participation. I know for myself that if I don't have to go to the soccer game, my husband's good to go, see ya, you go. Because sometimes it's hard to be involved in things, especially in the summer when you're wearing less clothes and it becomes very visible. I try not to put myself into too many new situations, but every time I go to a school function, every time I go to a business dinner, people don't ask me what's wrong with my arm, but they'll ask my husband, what happened to your wife? Carpal tunnel? Anyways. So I think what's important is to take care of yourself. I've learned a lot about taking care of me. I don't do well when I do nothing. So just to say, well, I have lymphedema, it sucks, you know, I'm just going to do nothing about it, is not a productive thing. For me, doing something makes me feel good. Going to physio, trying manual lymph drainage massage, going to the cross and getting my arm wrapped. As crazy as it sounds, at least I'm trying. To anyone in here with lymphedema, I think, we all need to pause. We need to acknowledge that this is hard. Accept it. It's not going away. It's part of our life. And respect the impact that lymphedema has had in our lives. That's a hard thing to do. You kind of got to go down to get back up. But I think you got to go there. And then you need to empower yourself with knowledge. You need to learn about the lymphatic system, about lymphedema, and how to take care of yourself. I think that knowledge is power. And it's helped me so many times, because I can go into a doctor's office and say quite confidently, this is what I have, this is what I know, this is what I think I need. And you know what? 9 times out of 10, I know more than he started at. And I know it's hard, but you need to advocate for yourself. I think everybody's an individual, and so everybody's lymphedema is a little bit different. So you have to take note. You have to start to notice what makes it better, what makes it worse. So I don't like to write a diary because, again, I find that a little too real and a little depressing. But I've been dealing with this for 9 years now. So there's things I know about myself. Things that make it better, things that make it worse. So every spring, for whatever reason, Edmonton thaws, Pauline fills. My arm gets bigger. So I originally had swelling in the spring, and I'm always a little bit worse in the spring. And I've told that to people, and they say, that doesn't happen. Well, you know what? It sure as hell does happen, because it's happening to me. So listen to what people say, because it might not happen to you, but it's happening to me. I know that when I walk and I exercise, I actually do feel better. I know that I do better when I wear my compression garments. So I know there's things that make me better and things that aggravate things, and I just have to be respectful and know my limitations. I've learned to be a personal advocate, and one thing I have to acknowledge, I probably was better at advocating for myself because I was a nurse. And I knew that that patient's thoughts mattered. And be damned, I made people listen. And I've learned to share the information that I've learned. I've had to share it with the physicians I worked with. I've had to share it with people around me. I've shared it with my coworkers, my therapists. I've shared it with a lot of people. And it's not that easy to do. And it's not easy to do when you see somebody you can help. So a few weeks ago, I met with a friend of mine whose sisters just had surgery for breast cancer. And I was talking to her and I said, you know, you really need to be careful. Watch for lymphedema. Did they talk to you about it? Yeah, but 25% chance I'd get it. Well, okay. So I said, I know, but you don't want to get it at all. You want to prevent it. What really matters here is preventing lymphedema, because I'm the picture of treating lymphedema. If it's out there, I've tried it. So don't get it, prevent it. And she said, well, how do you do that? So I started to talk to her about manual lymph drainage massage. Oh, good. Who pays for it? You. How much will it cost? $90. How many treatments? Oh, that's one. Oh, okay. And she said, but I can get reimbursed for this with my health care. Maybe. I said, but you know, they will only reimburse you if it's called massage, not manual lymph drainage massage. And you probably will only get $25. So yes, you get something. My yearly maximum is $300, so I'm pretty well done by mid-February, right? So she said, so you want me to get treatment that costs $90 for 1 hour for something I might not ever get? And I'm going, yeah, and I really want you to get it. And she's saying to me, that's a pretty hard sell. Yeah, it is a hard sell. but you know me, and I wouldn't be telling you this if I didn't believe it was true. And she said, you know, I'm going to talk to my surgeon, I think. And I said, I could tell you your surgeon is going to say, you don't need this. So sometimes you got to think outside of the box, and you got to do what makes sense and what works for you. So sharing your knowledge should be easy, but it's not. Ian's talked about this a lot, but take care of your edematous limb. Protect it from harm. It is my limb, it's attached to me. It comes with me everywhere. I do try to respect it. I wear gloves, I wear sunscreen, I wear insect repellent, and let me tell you, those little buggers here in Edmonton will bite right through a compression garment, no problem. You need to recognize and treat infections. And you know, that's easier said than done. I recently had an experience because it was spring, and I was filling, and instead of my arm getting big, I was out in the garden. And when I'm in the garden, I wear 2 pressure garments. And I have to be really careful because my arm swells when I do gardening. But I've chosen that's something I'm not giving up. So I was in the garden, and I wasn't out there for very long. I just didn't feel good. But my arm looked good. Wasn't swollen at all. And as the day wore on, I just felt off. I couldn't even tell you why, but I felt really hot. And I went and I had a shower. And I was getting undressed, and I noticed that I had a mark all across my side. And that mark was blisters that had all broken open. And I had developed chest wall edema. So my arm was good, it was good. But my side had swollen up. And from my surgery, I don't have a lot of sensation. So I didn't feel these blisters, and I didn't feel when they broke open and became excoriated. And so still, I'm dealing with a wound. You know, now I'm like, oh, that's bad. Everything I read said, that's bad. So treat and recognize infections. So I have done that. But recognizing infections is sometimes harder than you think, especially if you have a change in sensation related to your lymphedema. Compression garments, wear them. I had a summer where I'd started using some taping, and I had seen a physio, and they had said, you know, there is some studies that show compression garments cause muscle atrophy. You shouldn't wear them all the time. So I thought, well, that's good because it's summer and I don't want to wear these. So guess what? I'm not wearing it. And let me tell you, my arm filled up and I had a bad summer. And I've never got back to where I was. You know, you look at your high school pictures and you thought you were fat then. Now you're like, shit, I should have really enjoyed things. Yeah, that's what I often think about that. I should have worn that compression garment, but I didn't. And I'm dealing with, you know, the results of that now. So wear them. Keep them in good condition. I've seen pressure garments that are no longer beige. They're almost white because they're so stretched out. And I know that they're expensive, but make sure that you are using compression garments that still have compression in them. If you can pull them on without the green rubber glove, they're probably not good anymore, right? And I really advocate for manual lymphatic drainage. But again, as Ian said, you need to see a certified therapist. I've had hairdressers tell me, I'll give you manual lymph drainage massage, don't see him. So I'm like, yeah, no, I don't think I'll do that. So you really do need to know the right type of therapist and that they are certified. Take care of your body. Exercise is tolerated. Just listen to your body. When I'm doing something or holding something for too long, my arm starts to hurt. I know I'm doing those isometric exercises. I do short rhythmic movements to help with the lymphatic flow. I do avoid isometric exercises where I'm holding things for too long. Hydrotherapy, well, Ian's trying to get me in the pool. You know, I'm just frightened to drown. I'm like a one-arm swimmer now, and he's always saying, go in the kiddie pool and just hang out. And I'm like, then they know I'm crazy. I don't know. So I have to say that's the one thing I have not done, and I really do need to. Eat a balanced diet. Does that fix my lymphedema? Probably not, but you know what? I can fight an infection better, and I feel better overall. Be open to new ideas for therapy. You do want to make sure they're credible, that they make sense when someone explains them to you. Oh, that kind of makes sense. My philosophy is, if it ain't going to hurt me, I'm going to try it. So this is me taped. Ian was showing you the lady with the blue taping. How does this work, Ian? No. There we go. This is me. I'm taped. So I don't know, probably 5 years ago now, in the spring, I developed a hand edema, and my hand just blew up. And we put pressure garments on it, nothing was bringing it down, and I was at the Cross, and the physiotherapist there talked to me about taping my hand, and this tape actually goes all the way under my arm. And they did that, and I would say within a week, my hand edema was gone. So taping really works for me. I should have bought shares in the Leukotape company, because that happens to be the brand I use, and I would be a rich woman today. But so they taped me here, and Ian had already been taping me over my chest, or up the back of my arm and down my back, to try to promote my lymphatic flow. If I don't wear my Leukotape, I have a heavier, more swollen arm. I'm kind of like the Leukotape junkie. I wear it all the time, and it's part of my monthly cost. The other thing that I've tried is a nighttime pressure garment, and I don't wear it all the time. I'm going to show it to you. You might figure out why I don't wear it all the time. But when my arm is swollen, I wear this, and it actually helps me. If I work in the garden, I wear that when I go to bed. So when I put this, I bring this out at night, and my husband's like, great, look what's coming to bed. Yes. So it's not that appealing, but it has helped my edema. It might not help everybody. I got this through the Cross. The physio department there was able to help me get this. And you know what? It's helped me. I don't wear it every night. I don't wear it every night because, you know what? It's cumbersome. And I don't tend to roll over well in bed. First you put this on your hand, so to get the real image, it's like this, right? And it gets stuck in the bed sheets, and I've occasionally punched my husband. And then in the middle of the night, you hear me ripping it off, the Velcro. It's really loud, right? I wake everybody up in the house, but I can't keep it on all night, but it helps me. So I try things like this. I did get some money back for that, but it was because the physio at the Cross called it a splint. But whatever. My hope is that we are improving knowledge about this lifelong condition, not just my knowledge or any of the patients in this room, but of healthcare providers. We definitely know more than we did when I was diagnosed 9 years ago. We're talking about it. We're having a forum like this. We really are moving places. And we're talking about the type of research that's been done, that needs to be done. I read one study, and it was on lifestyle impact of lymphedema. And it was interesting because the author identified it doesn't matter how many patients you look at. I don't have to look at the right number. What I need to listen to is the stories they're telling me. I need to look at the impact on their life. But you know what? Healthcare dollars are not funded by anecdotal stories. They are funded by numbers, and we do have to get the right research done. But you know, do we all have to do it in Canada? We can learn from those other countries. I think we could learn something from the 14,000 people in Germany who are water therapists. We don't all have to just learn from Ian Souls, right? So there's a lot we could do. I'd like to see earlier diagnosis and intervention, and I think best practice guidelines will bring us there. Oops, wrong thing. Remember, and it doesn't matter whether you're a patient or a healthcare provider, don't underestimate the impact of lymphedema. It is so much more than a swollen limb to you and to the person you're taking care of. My blessings I have been very lucky in my journey. A big part of it has been the people that have become part of my wellness team. And you know, because they collaborate, they talk to each other about me. And the person they talk to most is me. I'm part of that team. I'm part of that wellness team. So I've been very lucky. My collaborative team has been made out of people that I see most often in the private system, but it's also been helped by the physio department at the Cross, the therapist there. And I'm so lucky to have them as part of my life. It's financially possible I can do this and get the therapies that I think are appropriate for me. I've been blessed that I was a nurse because it helped me navigate a confusing healthcare system, and it gave me the self-confidence to speak up to myself and advocate. And my family. You know, they're my cheerleaders. They keep me going. They think I've taught them something about surviving and living, but they teach me so much every day. And the biggest blessing you can have is to have a bit of humor. It gets you through things when, you know, what's that lady who says when you're in the pits, or at least it's cherries, or what's that Irma Bombeck quote? Anyways, thank you so much for listening to my story.
Thanks so much. I just want to thank Pauline for sharing her story, and I'm getting misty just thinking about it, but thanks so much. I know that was difficult, so we really appreciate it, and thanks for everyone for coming and attending. Thanks so much.
Thank you.
Pauline.
Wow, she brought me.
Thanks so much.
Thank you.
It's really great.